Hello everyone, my name is Fermin. I am the creative director of Voices of Resilience. Elizabeth and I are thrilled that you get to see the hard work that we have put into this film. The reason why I wanted to create this film is because I value mental health, especially in a Hispanic community where it is shunned upon. In this film, we cover topics of mental health stigma, increasing diversity, federal funding, and why representation matters. Some statistics to keep in mind before watching the film: in 2021 in the United States, nearly 8 million Hispanics have reported having mental health issues, and 4.8 million African Americans have also reported having mental health issues. About 37% of African Americans receive mental health treatment, and 10% of Hispanics in the U.S. have received mental health treatment. As you can see with these numbers, there is a mental health crisis in Black and Latinx communities, and this isn't something we should keep ignoring. If this continues, it will only get worse. We need to prioritize our mental health as well as physical. We hope that you take away something from this documentary and have a new understanding of mental health. Enjoy the film!
So first question, how can we destigmatize mental health?
I think we can do that by talking about it, by normalizing it, understanding that it is an issue that affects all families everywhere. There's nothing wrong with it. It's nothing to be ashamed of. It's something that can be treated in a variety of different ways, and we should support people that are going through these issues and understand the extra difficulties it brings to them and to their life.
I think just by having more conversations about it, and also being inclusive about kind of who's in the realm of these conversations, making sure to include marginalized people, or people who whose mental health aren't talked about as much.
Because it's really, especially in certain cultures, it's very hard to speak out about these things. So having, I guess, someone who represents that particular community might help a lot.
I think we can destigmatize mental health by talking about it more openly, realizing that everybody has their own mental health needs, issues, things that they have going on, and it's not insular and not limited to a specific person. Everybody deals with it, and if we recognize that it's a universal thing, it's easily destigmatized. Yeah.
Be authentic to yourself. Don't try to please people. It's okay if someone doesn't get you, they're not meant to be your friends.
Right.
Yeah.
I think people just in general should treat others who speak about these things with more kindness.
Decreasing the barriers for all of our interactions with different various communities. Part of it is making sure that information is available in native languages. It's also making sure that these issues are taught in schools, and the schools can have the resources to handle it, to deal with it, and to have discussions in classrooms and in our communities, and to provide parents with resources to talk about it. And then I think also just providing the means of disseminating the information on social apps, social media that young people use, that people at school use.
Being more open-minded to what people are going through, instead of rushing to judge people, kind of just focus on understanding what they're going through, and just having more conversations about it, kind of normalizing it in general, because I guess that's the first way to destigmatize, is to just talk about it more, and just increase conversations about it in the first place.
More community resources for mental health, less policing.
Why do you think the Black and Latinx community can be against mental health at times? Well, there's a lot of history.
If you look at a lot of the founding fathers of the mental health, they were all white men. They were all white men. And so when you think about white men, you think about white supremacy and the way that laws are being created, the way they're They're not seeing you as equal. They're not seeing your issues as important. So it wasn't designed to say, hey, we're going to help these individuals. We're looking at the disparaging issues in these communities and let's figure out how to fix it. No, it was, let's figure out how to keep them there. Let's figure out how to throw them in jail. When they sent a social worker to your house back in the 60s and 70s, it was to separate your family. It was to take your family away or separate them, or to throw you into an institution because you were still seen as less than or not as equal. So it was not the place that was designed for us. So with that in mind, why would I want to sit and talk to somebody, a social worker?
I think there's just a lack of trust, a lot of which comes back to, again, the way that systemic racism has evolved in America, whether it's the Tuskegee experiments that happened. There's just a distrust with the healthcare system in general in the Black community, and I feel like between, oh, I don't need help, I'm not crazy, I can do this myself, and I don't trust you, one of those two things is going to be enough to stop most people from actively getting the help that they may need.
The Black man in America, he came from somewhere else. He came from a country that was his own to land in a country that was not his home. That's traumatic. Everything that slavery embodied stripped the Black family. It stripped the Black man. So if you imagine, historically, what him in particular, now granted it affected his whole family, but he in particular, what he had to endure from the time frame that they were captured, put on the boat, and then arrived here for now years to be in slavery. The amount of pain, trauma, issues that were happening, and he could not take it anywhere. You're going to get whooped, you're going to get starved, you're going to get beaten, and then you're going to have to work on this field. And nobody wants to hear how you feel about it. Who am I going to talk to other than the other slave who we've now been trained? Boy, you better keep your mouth shut. If you want to keep living, here's what you need to do. Now, historically, the first person to get the blows was his wife and his family, because I didn't have anywhere else to place that stuff. So with all of that in mind, that was the generations that came before us. Those were our forefathers. And so you pass down all of what you have learned for decades. That's why people are like, slavery was so long ago, just get over it. It happened for years. And then after slavery, civil rights happened for more years. Segregation happened for more years. And then we finally make it, past the 80s? The 80s, but there's still mass incarceration. You just found out another way to enslave us, largely Black and brown men. That's centuries of oppression, aggression, largely impacting the man. Prisons are highly populated with men of color. So we don't have, or we haven't had, these places to deal with this type of pain.
There is a history of mistreatment already. So that alone in itself is going to make our people not want to go to see any type of professional help, whether it's for our mental or even sometimes for our physical, right?
And so it's not so much as this a stigma, it's more of a stain.
Why do you think the Black and Latinx community can be against mental health at times?
I think there's a stigma on mental health. People don't want to be labeled. So, especially in the community of color, it's not something we discuss.
There definitely is stigma. At least in a Puerto Rican Spanish household, it is shown that it's a weakness.
I think growing up, we always would hear therapies for crazy people, or honestly, it sounds ridiculous, but therapy wasn't a thing that Black people do. Oh, you don't tell nobody our business. We keep this in our house. It was, that's what we grew up with.
For us, what happened in this house stayed in his house. And that's where we grew as a culture.
With the verbiage we use now, like mental health, like that's a buzzword that like in a lot of black families has only existed for 5-10 years. Like prior to that, it was just, again, there were religious connotations like, oh, pray it away, go to church, it's the devil, da 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 da, or, oh, like, what are you crying about, toughen up, there's nothing wrong with you. And on the flip side, oh, you're crazy, there is something wrong, and it's just that you're crazy, you need to get that together, you don't need help, we'll work on that as a family.
People are often afraid of the stigmas around what it means to not be well mentally. I think that oftentimes you hear people say, you know, I'm not crazy, I don't need to see a counselor or a therapist.
At least in a Puerto Rican Spanish household, it is shown that it's a weakness, especially asking for help.
Unless you go to a professional, which again, now you're going to a professional, oh, you're definitely crazy. Why did you have to go see someone else for them to tell you what's going on in your head? Why don't you know that? And that creates this kind of battle within oneself of like, oh, I'm less than because I'm receiving help, which only exacerbates the issue.
If I say that I am depressed, that could mean that, oh, I'm going to be marked as or labeled as crazy.
Everything is just simply written off as, oh, you're depressed? That's crazy. What could you be depressed about when there's kids starving in Africa? Oh, you have anxiety? You're crazy. Why are you letting fear control you so much?
And crazy, cuckoo, right? You know, we stay away and certain stereotypes that go with that and bring that role, right? So that could take people away or prevent them from asking those services. And, you know, it's okay, it's fine. You get over it, you know, cry it out.
Let's just move past it. Let's move on. We don't need to talk about that. Or, you know, God will take care of that.
A lot of it does have to do with this point of view that it's like the devil in you, right? It's a very religious view of mental health, and that stigma is what makes it such a taboo to talk about in those families that, you know, strongly abide by Christianity, for example, or whatever religion that they subscribe to. A lot of times mental health issues do get swept under the rug as just, you know, praying it'll go away. And as a praying man myself, I do believe that, you know, prayer is part of, you know, coping with mental health issues. But to minimize the entire diaspora of mental health issues, whether it's anxiety, depression, to schizophrenia, to any number of mental health diagnoses, it's just not as simple as pray it away.
And that's what's really lacking in the church, because we think sometimes if we pray about it, or if we just keep, you know, meeting with the person, it'll, you know, eventually they'll get over it. The other problem that I've seen is, and I've heard of in the church, is suicidal thoughts amongst, especially young people. And we don't have a way of addressing it. It has been my experience that we treat suicide, when we hear someone's we try to treat it as a sin. And we try to say, well, if that person is struggling with those thoughts, you don't want to go, you know, to hell. Honestly, that's what I've heard.
So I believe that therapy helps you to navigate in partnership with the freedom it is that Jesus can give.
When you look at any other aspect of health, specifically let's go to physical health, if you break your leg, yeah, I guess technically speaking, there's a chance that if you just don't walk on it the wrong way and you just let it do its thing, it will heal with time. But why wouldn't you go for the crutches so that you could live your life the way that you want to live your life? Why would you want to just confine yourself to a bed and not be able to walk when there is a crutch you can use? And I think it's because we do view it as a sort of crutch, even though we view crutches as completely normal, that it becomes this battle of, nah, I can do this myself, I'll figure it out.
A lot of the times we will push through something. We won't identify that, you know, that we're struggling, because we're just supposed to be strong.
I think it's just the internalized part of our culture that said you're strong enough to handle it on your own, that makes men in particular, black men in particular, feel like, you know, I can do this, I don't need help. If I need help, that's me admitting a loss, that's me admitting defeat and saying I can't do this myself.
So there's a lot of stigma, and also part of our cultures are that, like you mentioned, you get over it, right? There's that strength or that kind of like protection of the family and what's happening here, and we're in this together, we could make it together, we don't need anybody, and which is a strength and it's a protective factors for our communities. But then for mental health, which is something that is needed, then it could be a barrier.
Definitely in Hispanic cultures, there's a lot of generational trauma that gets passed down, and people just don't like to acknowledge it. And I definitely think that growing up, it definitely was not talked about. It was shamed upon. It was made fun of in my household.
Hopefully the stigma, you know, starts to fade because of the conversations that we're having.
There are many reasons why people don't seek out mental health services, and one of those reasons is funding. Affordable health insurance plans or plans provided by the government aren't always covered. The reason for this is because not all practices can take those plans. Luckily, there are practices that can. You just have to ask your doctor, or kids talk to your social worker and see what therapists can take a lot of plans. Another issue related to funding is wait lists. There are many practices all over that have very long wait lists. The reason for this is that not all practices have the money to pay their staff, and there is a huge need for clinicians. The amount of people that are seeking services and that need therapy outnumber clinicians and services provided as a whole. Luckily, our governments have bills, and they're trying to pass laws so that they can give more access to us.
Where is the money? Because there is funds for us. There is a need for mental health providers who are Black or Latino and with underserved populations, and we want to be those people that are lacking. So we are ready, willing, and able. We need the funds.
If we have federal funding for like mental health, like to help people with accessibility, and then also like students going into like the mental health field to pay for like those debts, where do you think it's actually going?
They're there, and I know of them, but a lot of people don't know that they're there. So where do they go? They just sit there. They just sit there. And so I do let students know about the Substance Abuse and Mental Health Services Administration. So they do, depending on whether you want to go into social work or whether you want to go into psychology, counseling, you want to work with substance use, you want to work with children, if you want to go into nursing, they do have scholarships that will actually pay for like your education, and I think in exchange for 2 years you have to like work in an underserved area. So those are there. They are accessible. Those scholarships are actually, even the application is actually pretty easy to do online. And so I have taken students through that process, and I know of that federal system, and I know that if you want to work in substance use, there's low repayment for for individuals, and so I know I know it's there. I see it, and I try to spread it. But it's interesting how many people want to go into mental health, but may not even know of these resources. So I think they just kind of recycle them. They stay there, and we just keep, these federal programs just keep advertising that, hey, like we're here. It's a matter of people knowing where to look to connect with them.
Some of the bills that Rhode Island has passed are insurance coverage for mental health and substance abuse, Mental Health Provider Compensation Act, and the Health and Safety Behavioral Health Education Training and Coordination Fund. In Massachusetts, Congresswoman Ayanna Pressley has passed many bills to help the mental health well-being of not only people in Massachusetts, but also mostly women of color, children, and young adults. What I ask for you after hearing of these bills is to talk to your congresspeople and tell them to pass these bills because they are for the well-being of our country. And for the need of clinicians, if you are interested in the field of mental health and you want to explore it and it is right for you, pursue it. There is a huge need, especially in the BIPOC community, for representation to be given.
All right, what is your name and what do you do?
My name is Marinn Danis, and I'm a psychiatric mental health nurse practitioner.
My name is Julio Sabater, and I am a licensed clinical psychologist. I provide psychological services for children, adolescents, families, and adults, and I do counseling, assessment, and consultation, and I do that in English and Spanish. Yeah.
My name is Contessa Brown, and I am a clinician, a mental health clinician at two places actually. I am first a clinician here at Dyad Psychology as a student under Dr. Sarit Lesser, and I also am a clinician at Serene Way Wellness Center, formerly known as United Paths, which is another great facility and network out in the Pennsauken Providence area.
My name is Rob Badgett. I'm currently a student as well as a family partner working in community behavioral health.
My name is Nadine Colas. I am a psychotherapist, and in New Vision, I am the main therapist in the practice.
What made you want to become a psych nurse?
I didn't want to become a psychiatric nurse, but what made me want to do it was there was a need for it, and there really were not a lot of places where people could go. About 10 years ago, 14 years ago, when I worked in primary care, I had a lot of patients that we had to wait 3 to 6 months for them to get an appointment to see, a therapist or, somebody to prescribe their medications. And a lot of the older psychiatrists were retiring, and so a lot of practices were closing. So those individuals were being left without providers. And so I definitely saw a need for providers. And so rather than, just bemoaning and complaining about the situation, I realized, okay, well, maybe I could do something about it. And so that's what really made me decide to go into the field, was because I was tired of not being able to get my clients, my patients, the help that they needed. So I decided I'd do it by myself. So I went back to school so that I could actually manage their mental health and their psychiatric needs. So that's kind of how I got into it.
Why did you want to become a therapist?
What did I become? Okay. I always knew that I wanted to work with people. I knew that naturally people are drawn to me, and it's something that a lot of trial and error. I tried different fields, and my parents encouraged me to do nursing, but I knew that I wanted to be in the field, and that wasn't the capacity how I wanted to help people. And I also felt like there was just not enough people of color in the field. So I haven't looked back since.
There was a high need, believe it or not. Right now there's more need, but back then there wasn't a need for psychologists who would be black and also Latino or Spanish speakers as well, bilingual people needed in the field. In the state of Rhode Island, there are no, or maybe 1 or 0 neuropsychologists that are bilingual, bicultural, that are black, that can connect.
One of the reasons why I got into the field was that I didn't find a lot of individuals that look like me.
There's a high need for BIPOC therapists. It's just not enough of us. There's still a lack of about 75,000 therapists overall for here in America. So if you think about that, and we're still just a small part of that equation, yeah, there's a huge need, especially for representation.
Providers that people can trust, another issue, and I think that's another reason why I wanted to be a part of New Vision, because I wanted to be a place where people like us could feel safe to be themselves and to talk about the cultural challenges and the taboo without feeling judged or without feeling misunderstood or without being diagnosed because someone may not understand some component of their culture.
If I understand where you're coming from and you understand where I'm coming from, right? In a conversation, just a regular conversation, two people speaking, that doesn't mean that we don't have the capacity to have empathy for a different culture or different person that doesn't look like you or talk the same language, or or they're not bilingual or whatever. However, when that's a match, there's a match, there's more of a connection that happens.
So there's so much that goes into not wanting to go to a professional, especially if the professional doesn't acknowledge you. If they're not culturally competent, they're not going to acknowledge your experiences that you're going through, or that I'm going through.
My prayers for more people of color, but not just color, but people who are qualified. I think that you might have some validity. You might not look like me, but you still might have some value that I can gain something from. And if you're qualified and you're here to help, I think that we're heading in a good direction.
The conversation is so important. The conversation shouldn't be tiptoed around.
We sometimes don't even know that we have a problem because we don't really talk about it. So if you are not aware that something is maladaptive or abnormal, or that there is a better way to do something or a better way to feel, then how are you aware that you need to do something about it? So I think there's a lack of knowledge about it. Cultural norms, obviously, it's taboo. People don't really want to talk about, there's still a negative connotation around depression, and especially psychotic issues, and then there are the other issues like substance abuse, or even intimate partner violence, things that people are afraid to speak up about, but that also affect our mental health, and so there's a lot of shame still around it.
Like whoever ends up watching this, whoever ends up listening to this, hopefully this, sparks them to have a conversation, because that's what this is all about. That's really what the mental health shift that's happening right now really all goes back to, is we're talking about this now. It wasn't talked about before. It was just labeled and dismissed.
We cannot recover from what we don't uncover.
It's as simple as just starting the conversation and making sure it's not coming from a judgmental place, but an educated place of understanding and love, really.
Hi, my name is Elizabeth Mangeni. I'm the executive producer of Voices of Resilience. Me and Amber are thrilled that you got to watch the work that we put into this film. The reason that I wanted to create this film was through a research project that I did, which was a paper about the history of psychology through my race, culture, and ethnicity. In the research that I did, I saw the way that the Black community viewed mental health, and there is a huge stigma around mental health, and it's the reason why there is a mental health crisis, especially in communities of color. A lot of people have the misconception that you only need therapy if you're clinically insane, but that is totally not true. Therapy is designed so that you're not continuing to go forever. Therapy is designed so that you can tell your clinician that I don't need therapy anymore and I'll be okay on my own. Clinicians and professionals give their patients tools that they need so that they can use these tools to cope mentally and also be mentally healthy. I know that there's a huge distress in the healthcare field, and that is because it's mostly designed to help wealthy white people. But there are many diverse professionals out there seeking to help their community. You just have to find which therapist is the right match for you. I encourage you to think deeply after watching this film and understand the importance of destigmatizing mental health. We have created the idea that mental health is a taboo, but it is not. If you or a loved one are struggling with mental health issues, please seek a therapist or somebody to talk to, because your mental health is really important. Thank you so much for watching.